There is a echo, I think.
I think we are good now. We can start. Thank you.
A very good afternoon to one and all. On the outset, I would like to thank Dr. Dev and my dear friends Cheryl and Shubda for having me here. I'm going to be talking about the use of supplements in diabetes. We all know that dietary supplements for diabetes are scientifically designed to help maintain normoglycemia, help manage appetite and food cravings in our patients, help with weight loss, and of course, offer the ease of preparation and convenience to manage the condition. Again, medical nutrition therapy, as we all know, is one of the most important, the third pillar in treatment management of diabetes. And MNT is important at all levels of prevention, be it pre-diabetes, managing the existing diabetes, and preventing or slowing down the rate of complication in long-standing diabetics, people with diabetes, to be correct. There's enough evidence that MNT can improve outcomes and reduce costs, and the diabetic-specific supplements are a great tool in MNT toolkit for diabeticians and diabetes educators to individualize the treatment. So some of the diabetes-specific supplements that have evidence and are having emerging evidence are, of course, the meal replacers, protein supplements, fiber, micronutrients, which include some of the vitamins, minerals, zinc and chromium, some foods which can be and are being used as supplements, and of course, symbiotics, and there are a few more. So if we start off with the meal replacers, I'm going to be presenting the latest and the most current data that we have on the subject. There is evidence, we all again know that meal replacers can work as part of the treatment regime. This is a very recent study published in BMJ. It's a RCT multi-center study where the patients, people with diabetes, were given the meal replacers for breakfast and or afternoon snack. In fact, this study extends the existing scientific evidence because what was seen is that when the breakfast was replaced with DSN, it favorably impacted the postprandial glycemic response. And when the afternoon snack was replaced, there was a reduction in the overnight glycemic variability. In fact, there were additional benefits also when the afternoon snack was replaced with a meal replacer. There was a reduction in craving for starchy meals or carb-rich snacks, which was an added benefit. So overall, the advantages of meal replacers are, of course, we don't need to guesstimate. We exactly know the calorie and the macronutrient composition of the meal that we are prescribing for our patients. There is no meal planning and cleaning and chores required from the patient's point of view. And of course, there is extreme ease of preparation and transport. On the con side, of course, meal replacers can become monotonous if given for long run. For the long run, some shakes have sugar alcohols which may not be well tolerated, and of course, if overall aim of the program is not lifestyle modification, then weight may be regained. Coming to the next set, supplements, protein supplements. Again, we all know we are a carb-loving nation. We just love our carbs, be it north to south or east or west. And primarily, the population is vegetarian, so we are not even meeting our basic requirements of 0.8 grams per kg body weight. Now, protein-rich foods are extremely important for people with diabetes because they improve glycemic control, increase satiety, and also, of course, promote weight loss. Now, protein coming from whole foods is, of course, ideal, but that may not always happen. And that is where the protein powders or supplement have a role to play. Again, a very recent study published in BMJ. It was a single-blind, randomized, again, crossover study where the patients were given 10 grams, around 10 to 15 grams of whey protein just 10 minutes before each meal, the three main meals. And what happened was that this enabled patients to achieve 2 hours more per day of remaining in the euglycemic range without increasing the risk of hypoglycemia. Also, these results happened without a change in patients' medication dosage, their dietary intake, or physical activity levels. So again, a novel way of using protein. We know that as soon as we add protein in the meal, there are multiple benefits for diabetes. Fiber supplements. Again, we all know that the consumption of dietary fiber is inversely related to the progression of type 2 and can flatten the glycemic and insulinemic responses. Again, a very recent study, which was basically a meta-analysis, which kind of investigated the extent of dietary fiber coming either from diet or supplements, and its role and how it would improve the different glycemic parameters, showed that there were beneficial effects across the board. There was a reduction in A1C, in fasting blood glucose, in fasting insulin levels, and in HOMA-IR score as well. So there is sufficient and very robust evidence telling us that dietary fiber can be a very, very important adjunct in the MNT for diabetes. Now, this fiber can, of course, be soluble or insoluble, but when diabetes is concerned, it is the soluble fiber which has been studied more and also has a more important role to play in glycemic control. And this fiber can take the form of fiber supplements, which could be a psyllium husk, inulin, guar gum, flax, beta-glucan, and of course, FOS. Coming to micronutrients now, if we talk about vitamins, water-soluble vitamin B12, a B12 supplement can be useful in people with type 2 who are deficient in B12. And we see that all the time in our clinic. Vitamin B12 deficiency is quite common. And then there's another group of people who are on metformin therapy. There, the vitamin B12 levels are compromised. They have lower levels. And that is where, again, B12 supplementation would be used. Vitamin C, again, a recent meta-analysis shows that supplementation with vitamin C may improve fasting blood glucose, but not HbA1c in individuals with type 2. Coming to fat-soluble vitamins, again, we know that vitamin D has a role to play in glucose homeostasis. There is quite a bit of research on this. But again, a 2023 systemic review and meta-analysis of RCTs, when it examined the role of vitamin D supplementation on different glycemic parameters, showed that the most clinically significant effects were seen when patients were vitamin D deficient, obese, and of course of Asian origin. So we need to look out for vitamin D status in our patients, not just worry about the calories and carbohydrates. There is also an association between high concentration of vitamin D in the blood during childhood and a lower risk of type 1. More research is needed to understand this link, but there's one thing experts agree on. If one is deficient in vitamin D, a supplement can help. So we need to actively look out for the vitamin D status of our patients, and also make sure that a lot of people are indiscriminately using vitamin D supplements. That also needs to be checked. Zinc is the new kid on the block as far as diabetes is concerned. In a recent meta-analysis of 36 studies, of zinc supplementation, 30 reported positive results. And the improvements could be in fasting glucose, A1C, even in markers of diabetic kidney disease. And in fact, in pre-diabetic population, zinc supplementation reduced progression to diabetes along with improvements in fasting glucose, OGTT, and insulin resistance. So again, this is something that we should keep in mind. Chromium is an essential nutrient in carbohydrate metabolism, we all know, and there are these multiple mechanisms through which chromium works. Based on these various mechanisms of action, supplementation seems to improve glycemic control. And again, a systematic review and meta-analysis of 28 RCTs, which was done in 2020, showed that there were, again, positive effects. And the intervention could be from 4 to 25 weeks. And the dosages were different, but there was a positive effect on fasting glucose and insulin levels, and even on A1C levels. In a subgroup where the intervention was carried on for more than 12 weeks, the reduction was even greater. Additionally, all the glycemic control indices changes were not dose dependent, and there was significant decrease even in doses less than 200 microgram and in doses over 200 micrograms. So of course, the major drawback is that in these studies, the supplementation used is different dosages and different types, and standardization is necessary before making dose recommendation for patients. Other supplements, ALA reduces pain from diabetic neuropathy, but this is seen more from the injectable form. Results are mixed with oral supplements. Some functional foods which are used as supplements, fenugreek, again, we all know its use. Alkaloids such as trigonelline and fenugreek seem to be responsible for the hypoglycemic activity, and even the fiber, the glucomannan fiber and the amino acid, hydroxyisoleucine, also seems to have a role to play. Again, a 2023 systematic review and meta-analysis has demonstrated a decrease in fasting, postprandial, and A1C levels, as you can see in these charts. And the form of fenugreek which was used in these trials was either capsule, powder, coated tablets, seeds, or even seeds soaked in water. Cinnamon, again, a lot of questions, but a lot of work has been done, and this is a meta-analysis of RCTs investigating the effects. And what has been seen is that cinnamon supplementation significantly reduces fasting levels among type 2. The result of this current meta-analysis has shown significant differences in A1C levels between cinnamon and placebo groups. However, until we still have some more robust data, cinnamon, since it's a fragrance seasoning, it can be used to flavor the food instead of sugary condiments. So we need to encourage our patients to enjoy sprinkling of cinnamon on the beverage or on the porridge. Karela, our homegrown supplement, again, a lot of evidence why it works. The active ingredients have been identified, and which is, there are 3 of them. And besides that, there's also the lectin, which may be a major factor behind the hypoglycemic effect that develops after eating Karela. In fact, a 2,000 milligram daily dose of bitter gourd significantly reduced blood glucose levels among patients with type 2, although the hypoglycemic effect was less than 1,000 milligram of metformin. This one is the new kid on the block. I'm sure some patients have started asking you whether they should be taking the insulin plant. Animal studies have shown that it has a huge promise, but we do not have human studies to, for us to be able to use them freely. Lastly, everyone has been talking about the gut microbiota, and of course, in obesity and diabetes also, the microbiome is disturbed. So the exploration is on whether giving prebiotics, probiotics, symbiotic supplementation, would it help treatment of diabetes? This is a absolutely emerging field, so we need to wait for some data. Supplements not to have, I think this is also very important for us to know. So vitamin E and St. John's wort, our diabetic patients who are on blood thinners, we need to make sure that they're not taking mega doses of vitamin E. And the blood thinners could be the traditional warfarin or the newer ones as well. But they should not be taken by patients who are on blood thinners. Niacin, some people do take niacin to raise their HDL cholesterol, but niacin raises fasting glucose levels for people with diabetes. So again, we need to check on this one, whether there is a interaction or the patients are taking this, our diabetic patients are on niacin. In conclusion, I would like to say that diabetes imposes huge economic burden because of its increasing prevalence and high cost of treatment, because it's a lifelong condition. Hence, lesser expensive forms of therapies such as supplements and dietary strategies are being studied to help manage diabetes. Despite lack of clinical evidence, consumers will continue to take dietary supplements for perceived benefit regarding diabetes. Thus, it is important to be knowledgeable about common supplements and their potential effects. While some supplements are better researched than the others, there is scope to perform better designed research studies in order to confidently prescribe these supplements to patients. Thank you so much for your patient hearing.